Hello everyone, I'm going to explain about how to do blood transfusion. In the previous video I talked about oral medication for the same guy John Smith, and in this one I'm going to talk about so what Mr. Smith knows and what are the things that we need. So basically we are doing blood transfusion because this guy has anemia and he has lost a lot of blood, and there are basically 6 documents that we need, like the consent. So I'm going to start with the VIP score, which we do in cannula, the intravenous therapy order, like how much blood we are giving. These two. The third one is the blood pack information, like the things about blood, the donor, all the things, the blood group. And the fourth one is the medication chart to check the allergy. Fifth one is the most important consent form for blood transfusion, right? So it should be signed by the patient. And the sixth one is the fluid balance chart, which we don't have it right now, but we will have it, so we will write it down. So after we know what are the things that we need Alaris pump, which is the pump that we do to make sure that the blood is coming properly, and we need saline on side. We need IV giving sets. We need a floss for saline, labeling, and drawing of needle as well, saline, and alcohol swab as well. So yeah, these are the things that we need. So how do we start, right? So these are the things that we have to keep in mind. So you go to the room. Hi, John, how are you? My name is Hansel. I'm gonna be your Ian for today. How are you doing? Can I have your full name, date of birth, MR, and your allergies? Done, right? So do the 11 rights right there. Right patient, right order, right dose, right drug that we are giving, right thing. So after that, just tell, I'm gonna do your blood transfusion. It might take 4 hours, and normally it takes 4 hours. And the thing about blood is that once you take out the blood from the fridge, it has a very limited amount of time, that is 30 minutes. So within 30 minutes you need to start the transfusion, right? And just because of that, just tell him that if you want to go to the washroom before that, because it's going to take a while, please do. And is the lighting okay for you? Everything done, and you go to the medication room, you start preparing the items that you need. I say like 6 consent form, right? And then also, like, when you go into the room with him, take the consent form and then just tell him that is this the consent form that you fill out, that like, is this your name, is this your signature that you did, to reassure that he is ready, he is like, he has the right to refuse, right? Because he say, you might feel like, oh, I don't want to do it, but that's why we need to ensure that we are telling him again. Now once that's done, you go to your room, you find out your things. Let's say the saline that I need, right? The saline I need, the thing, the drawing of needle, right? And I'm going to draw that as well, right? So saline's done, you label it, done. So for this is the only thing that we need. And after that, so after this one, you go to your so you have all the items that you need, right? After this, I forgot. So after this, you will do your first check, like right patient, right dose, right to refuse, right response, right documentation, right forms that we have. You do it yourself. That's the first check, and you call it RN. The RN will have a look. Okay, this is the right, and there is a blood and saline. So in the blood, what you have to do is, like, so this is the blood, right? So you have to check like the name of the blood donor, the when was it issued, and like make the blood packet upside down to check if it's clotting, if there is viscosity, if how intact is the blood, right? To make sure that the blood is fine. And once that's done, you need to write the name of the blood product number, initials, and who did the checking as well, and when was the time collected, time started, time completed as well for this one. And once that's done, so basically you are ready, right? So you go to the patient's bedside, then you have your saline ready for the pre-flush as well, and you check your cannula, you do your VIP assessment. That's why we do have the VIP chart as well, just right here. So you do your VIP assessment as well, look at the cannula, swelling, ask for the pain, do you feel any pain in there, and then clean the hub for 15 seconds again for the flush. Do the flush for 15, like take this out, use your alcohol swab to flush, and then this is flush, right? Flush very slowly because we don't want to give this spits off. So once that, dispose that, and once that's done, take it, turn off the um, the hub. And after that, what you can do is, so start, so there is a pump, Alaris pump, right? So start putting blood there, saline there. You know how, what's the total of blood? If it's 340, then 340 divided by 4 is 85 per 45 85 is the rate per hour, right? And volume to be infused is, the total amount of blood that we have is 340. So 340, 85 and 340 will be in the Alaris pump, and we'll put it there, we'll line it, we'll clamp it. Before we do that, clamp it, and then the wires on, and we're gonna unclamp the thing. We're gonna unclamp there, so the blood start coming, and then we're gonna take the end of the cap slowly outside, because so that the pump will, the blood will come. And if there is any bubble, you can use your finger to make sure that it doesn't fade away. Once that's done, you're happy, ready. Analyze yourself. What are you doing? Cool. Now you did your VIP assessment, cannula is ready to go, right? We don't need to recite. Cool. Now what you have to do is, like, if cannula is fine, that you don't need to do anything, then you will easily inject that blood part into the cannula, right? Into the cannula, put it there, and then lock it. And then once that's done, turn on the machine, right? Turn on the machine and start the infusion. You can start the infusion, and put your rate, volume, whatever that is, and you can basically start the thing, and then it will goes on and on. And once that's complete, you can take it out, you can clamp it, you can take it out, and start the saline one. As usual, saline is the same rate as that. So yeah, 85 for saline as well. And because saline will be the same as that, so that's the reason. And yeah, basically you just need to check that all the things that you did, and if there is any abnormalities, you need to do that as well. So I repeat, abnormalities, the RN knows that infusion should be okay. Data reason, I'm effective by monitoring his repeat hemoglobin 4 hours. So you have to, so I forgot one thing, you need to check the vitals as well. So before starting the infusion, you need to check the vitals before, due, 15 minutes after, and after. I'll check the right. So basically this is it. This is all blood transfusion. This is not rocket science. It's just that you need to be careful about what you are doing. You need to have a rationale of what exactly are you doing, and you'll be fine. And for saline as well, it would be the same as, it would be the same rate as same rate as blood, right? 10 ml flows before, after, right? Blood transfusion before starting, after starting. I'm checking the transfusion consent form signed and match the order, gather equipment, IV fold, giving sets. Cool, sounds good. That's all you gotta do. Well, I don't have the equipments right now to show you how exactly it's done, but basically that's the reason, you know. And you'll be all right if you understand the rationale that why you do what you do. Then yeah, it will be fine. And thank you for watching. I will make another video on maybe I think I will make another video on saline or something. Thank you for watching.